So, today we're going to talk about a health scare that absolutely blew up on social media. We're going to break down how one single post can create mass panic, and more importantly, how you can tell the difference between a rumor like that and the official health data that can actually, save lives. Let's get into it.
Okay, so our story kicks off in Houston. This is where one social media post started a total firestorm of fear and, well, a whole lot of bad information. It all began with this one little image.
Take a look at this. This is the post that started the whole thing. It's just a screenshot, right? But with a claim that is just jaw-dropping. Over 42,000 new STD cases in Houston in 1 week. I mean, it was basically engineered for maximum shock, and boy, did it work. It just spread like wildfire everywhere. And that firestorm just got bigger and bigger. Online creators jumped on the story, amplifying these already insane numbers. They started breaking it down into even more terrifying specific claims, just pouring gasoline on the fire.
And just like that, the whole thing spiraled. It wasn't just a number anymore. It became this urgent, almost hysterical call to action. The message was loud and clear. This is a disaster, an absolute catastrophe, and you need to get tested right now.
And this is where it gets really serious. This is where the online panic jumps off the screen and into the real world, causing some intense personal anxiety. People who saw these posts, they didn't just share them, they internalized them. They started thinking, wait, could that be me? And that created some very, very real fear.
Okay, so you've got all this fear and panic spreading like crazy online. But what was the official response? What did the actual health authorities have to say about this viral claim? Let's find out.
As you can imagine, with the online panic hitting a fever pitch, the city's health officials knew they had to jump in and set the record straight.
And there it is, the moment of truth, the central claim of that viral post, officially and very directly declared false. The health department's statement couldn't have been any clearer.
And here is the context that changes, well, everything. That 42,000 number wasn't 42,000 positive cases in Houston. It was a complete misreading of a much, much bigger set of data. It was the total number of tests, both positive and negative, for the entire state of Texas. That is a massive difference. This whole thing brings up a really important question. If that viral post was so incredibly wrong, then how is this kind of information actually tracked? What does the real process look like? Let's pull back the curtain on how public health data really works.
This chart really shows the two parallel universes we're dealing with here. On one side, you have the official reporting. It's methodical, it's careful, it looks at trends over a long time. Then on the other side, you have the viral version, which takes that data and twists it into a sudden, dramatic crisis. It's a textbook case of losing all context.
See, the whole official process is actually built on a legal framework. Certain STIs, think chlamydia, gonorrhea, syphilis, they're classified as notifiable diseases. That just means that labs and doctors are legally required to report every single case to health authorities. It's not optional, it's the law.
From there, the data flows through this really structured, verified system. It starts local, with individual reports. Then it gets bundled together by the state, and finally, it's shared with the CDC to get that big national picture. It's a process that's all about accuracy and verification, not speed and shock value.
So why bother with all this slow, careful data collection? What's the end game here? Well, let's see how this data is actually used to save lives.
Because this is the whole point. The data has a life-saving purpose. The goal isn't just to make a scary number to tweet about, it's to find people who need help and connect them with the medical care and the support they need to get healthy.
And this right here, this is such a powerful example of that system working. In the Houston area, an incredible 80% of people who get a new HIV diagnosis are connected with a care provider in just 3 months. That's the real story. That's the real-world outcome of good official health data. So you see, just watching the numbers is step one. The real job of public health is to investigate the cases, link people to treatment, and then make sure those treatments are actually working. It's a continuous cycle of care, not a one-off cycle of panic. So what's the big takeaway from all this? As someone scrolling through your feed, how can you tell the difference between a real health alert and just viral noise? Let's break down the signals.
Honestly, it really comes down to spotting the signals. Official reports, from trusted places like the CDC or your local health department, they're going to show you gradual, confirmed trends based on actual lab data. But viral claims, they're almost always these sudden, dramatic spikes you see in screenshots from anonymous accounts. The difference is night and day.
Ultimately, knowing how to spot the difference between a real signal and all that viral noise, it's about taking back control. It empowers you to make smart decisions about your health based on facts, not on fear. So, the next time you see some shocking health claim online, just ask yourself one simple question. Who is telling me this? The answer to that question tells you everything you need to know.